Emily Smith. I'm a consultant respiratory physician in London, and I'm here on behalf of Plant-Based Health Professionals UK, which is an organisation founded in 2018 by Dr. Shireen Kassam, who would have been here today, but due to family illness can't make it. It's an organisation that was really founded to fill the gap of knowledge amongst healthcare professionals in terms of the huge evidence base for the benefits of plant-based diets. And increasingly, we have expanded to really cover lifestyle medicine more generally and think about how we change our healthcare service, which is currently a sickness service, into a health promoting service. So this is our big campaign, and the reason that we think it's important to talk about food when we're talking about health, I will come to, but of course it's also absolutely key to the climate crisis. And all we hear is talk about fossil fuels, which is really important, but food does not get enough of the airtime. And if we just think about health specifically and the way that the climate crisis impacts on health, there are many ways in which food is important. So none of us want to see another pandemic, but we are currently, growing the next pandemic in a massive livestock industrial farm somewhere in the world. In terms of antibiotic resistance, there are many reports out about the future we might see if we don't tackle antibiotic resistance. Simple infections being untreatable, people dying because they scratch their finger and get sepsis. That's a world none of us want to see, but again, a lot of the antibiotics we use is in animal agriculture. So for any of these issues, if we're thinking about the impacts of the climate crisis on health, we come back to the food system every single time. So it's a really powerful way that we can tackle this problem. We are launching today the Plants First Healthcare campaign as a way to really take action. So we've heard the evidence that the report that's out today from UK Hack will give even more evidence to the fact that we must tackle food if we're going to tackle the climate crisis. But Shireen and I and our organisation at Plant-Based Health Professionals UK have worked over the last, the organisation's been running since 2018. We've been working on this campaign for a while now, and looking at where the challenges are and what the barriers are, and actually how we can make this reality. And so this campaign is designed to do that. The NHS has committed to net zero by 2040. We will not meet that target if we don't tackle food. It's impossible. We're making great progress on the NHS on things like anaesthetic gases, inhalers, energy, but we are not talking about food. And there is no way for us to meet our climate targets, never mind our nature targets, if we don't tackle food. And that's true of the larger system as well. But in the NHS, we have a lot of people eating a lot of food in a lot of healthcare organisations every single day. And so we have a real opportunity here to make a big impact. And we know that it's really clear what diet is the best for the planet. So you will hear lots of people talk about different diets and the nuances of the Eat Lancet diet, the Mediterranean diet, whatever diet. These labels are not actually that important. What we're all talking about is a plant-predominant diet that really minimises as much as possible, and we would advocate that actually meat, dairy and fish are not required for a healthy diet, but if people choose to have those included in their diet, that's fine. But what we're all talking about is the fact that the best diet for the planet is plant predominant. So there is no confusion here, the data is extremely clear. And if we just think about milk, again, we can get caught up in the sort of comparing almond milk versus oat milk. This is an irrelevant conversation when we compare to dairy. In every possible way, if we look at land use, if we look at greenhouse gases, if we look at water use, if we look at pollution, dairy is the problem. And we have many alternatives that can support good health that are freely available, and so this is a transition we need to escalate. So, why are plant-based diets a solution? Well, they really are a great option if we just think about our health crisis. When I'm back at work next week, and on my ward, it will be full of people living with chronic disease, and really struggling, and really having a really difficult time with things like obesity, arthritis, hypertension, diabetes, and all the complications that those things bring. And a large proportion of those problems will be driven by poor quality diets. So a plant-based diet, if we were only thinking about health, is what we should be recommending as healthcare professionals, because there is such opportunity to improve the health of this nation through diet, and we're just not capitalising that at all. So there are many ways in which this is beneficial, and as all of our guidelines say, including the British Dietetic Association, this diet is appropriate for, an exclusively plant-based diet is appropriate for all ages. I was just mentioning some of these chronic diseases. If we adopted a plant-based diet, we could massively cut the proportion of these conditions that we see. we hear every day about how the NHS is buckling under the pressure of an ill population. And again, if I was offering you a drug that could have these impacts, you'd all be clamouring for it and demanding it was available instantly in the NHS for every single patient, because these benefits are huge and the evidence base is incredibly clear. Not only that, but there are financial savings. It is very rare that I can talk about an intervention that not only is good for the planet and for people, but would actually save money. But this is the reality, and there are several reports which you can read from some of our references, independent reports which have looked at the benefits, both immediately in terms of cost savings in the food that we're actually giving to patients in hospitals and the immediate cost reduction in switching to plant-based alternatives, but also the longer-term benefits in terms of the health of the nation and in terms of the economy. So we hear a lot about getting people back to work. Obesity injections are not the elixir. We need to think about people's health and support them to make good choices, and plant-based diets are a way to do that. So on every possible measure, this is advantageous. And this is now part of lots of policy documents and recommendations, and yet we haven't yet translated these recommendations into actual action, and that's what we're looking to do today. Working on this, we have identified some barriers to this, and so we do need to tackle those, and that again is part of what our organisation is doing and is looking to do, because our education at present does not provide us with the necessary information about nutrition. My education, it was a few years ago now, at medical school, but the only thing that we were taught about nutrition was about nutritional deficiencies, extreme nutritional deficiencies, like how to spot scurvy. I've never seen scurvy. I have seen many, many patients who are ill because of the diet they have, but my education didn't prepare me for that. So we'll learn all of that later on. And that will be true of all of us. And this is a cross-sectional survey of registered dietitians that's in press and will be published very soon. And what this showed was that, again, they're still being let down by the education that they're receiving. And so they're not empowered with the evidence that's there if you look for it, to be able to make really strong recommendations and support people really expertly using all of their skills as dietitians. And this was true of people who had trained many years ago, but was also true of people who trained very recently. So there is an education gap amongst all health professionals, including dietitians, but we have the knowledge here in this room and in our organisation and elsewhere to solve this gap. So that's part of what we need to do, is to bring everyone up to the knowledge that we all need to really confidently talk about the benefits. Plant-based Health Professionals UK has been filling this gap since its inception in 2018. There are many ways in which we do this. We are an education and advocacy organisation, and so we are now partnered with the International Board of Lifestyle Medicine to offer the diploma, which many of us have completed, which I can tell you involves a lot of reading of primary literature, but is excellent. We offer student-selected components in 5 medical schools and are looking to expand that so that we can get that education in early at medical school. There are our members, including our founder, Shireen, has written numerous books, but this one in particular is a textbook heavily referenced on plant-based nutrition in clinical practice, which is an excellent read. There is a university course at Winchester, ready for healthcare professionals to access information. And we also have a podcast, which I'd really strongly recommend you all listen to. It's called In a Nutshell. It's really accessible. It's 2 GPs who are practicing GPs who are interested in lifestyle medicine and plant-based health particularly, and interview people, and they give recipe ideas, which are always excellent. And it's very accessible both for health professionals but also for the public. So we are filling the education gap. In the NHS right now, the way we talk about food is not evidence-based. It is not following the guidance. It's not following the guidance that we write ourselves. This is an example of the NHS weight loss app. And what we have are pictures of food that does not reflect what we've just seen in the Eat Lancet guide. So the visuals that we're using when we're talking to people are not helping us. And if we think from a climate perspective, why have we got steak on here? Like, this is just goes absolutely against all of the messaging that we're trying to do in many of our documents and talks. So at the moment, we've got a real disconnect in terms of the narrative and the use of imaging between what we know the evidence tells us and what we're actually showing to patients, which does not help them. And these are some extremely sad pictures of some hospital food from a few different hospitals across the country. And again, the messaging, I mean, it speaks for itself. This is not the healthy, whole food, plant-based food that is gonna get them better. You can come out of an operation where someone has just removed several feet of your bowel, which your bowel cancer may well have been driven by eating processed red meat. And you can come out of your operation, and the very next morning you can be served processed red meat within a hospital. Like, tell me how that makes sense. We have done a lot of work trying to really, hyper-local in our own institution and try and get some improvements to our menu, and we have had some progress on that. So no longer are things called vegan, because that is an ethical stance and puts people off as a label, and it's really not necessary. It's not a relevant term within the healthcare space. What we're talking about is plant-based food. So we are very keen to just use words that are food related. So we have things like lentil shepherd's pie. That tells you what it is. It's an appealing dish. It's open for everybody. Whatever your dietary pattern might be, you don't need a label. You can have a lentil shepherd's pie, and hopefully it will be delicious, although I'm not sure. But there are still problems with these menus. And for example, a massive issue is that we have a heart-healthy label on a beef casserole. Beef is not heart-healthy. The evidence does not support this recommendation. And we have pointed this out numerous times, but there it is. So again, our current menus do not reflect the evidence base. So we must change this. If you ask for plant-based food in a hospital today in the UK, this is the kind of thing you will get. Now, I am fully plant-based and have been for 7 years. No meal I've ever eaten in that time has looked like this, okay? I eat a nutritious, abundant, delicious diet. It looks nothing like this. And yet this is what the offering is. It's completely inadequate. And we can do so much better. So the NHS has made a commitment to be net zero. There are green plans across the country from lots of healthcare organisations. We have looked, our research assistant, Isabel, has looked at the green plans of the hospitals, and it's not great on food. So 50% include a section on food and catering. That should be 100% clearly, since it's such a major driver of the climate crisis. 48% aim to increase the availability of plant-based options, which is fine, but I mean, that would have been a great recommendation about 10 years ago. 5% aim to promote and encourage staff, visitors and patients to choose plant-based options. So they might have it available, but they're going to do nothing to nudge people in that direction or provide any information. And 83% refer to local produce. And we hear this again and again and again. If we look at all the data, and if you map out the carbon footprint and the environmental impact of food, it is largely down to the food content. If it is meat and dairy, it's huge, and if it's plant-based, it's very small. If we're then comparing between, some soya and some beans, then maybe taking into account whether it's locally sourced is relevant. But for most of the food we're talking about, the most relevant thing is, what is that food? How is it produced? What is the land use? What is the water use? It is not whether it's local. So I'm here for local produce, but once we have already fixed the problem of what we're actually serving. So this does not align with the evidence, does not align with the recommendations. The immediate response we get when we say, why don't we change this? We could do so much better, is this would be outrageous, patients would riot. So we asked some patients, and we actually asked them if they would, this is not the campaign that we're talking about today, we asked them a much bolder claim. We said, how would you feel if we entirely removed red and processed meat from our menus? And actually, you can see that there was some strong agreement, some agreement, and lots of people are neutral. So actually, more than half of people are absolutely fine for us to completely remove both processed and red meat. That's not what this campaign proposes, but this is just to counter that idea that actually patients don't want this. We haven't asked them, and when we do, actually many more people are in favour of this. So we're doing them a disservice by making lots of assumptions. And what do our staff say? They are supportive of many of the things that we would want to see. So a large proportion of people are supportive of adding more dishes that have plant-based protein in them, removing processed meat, and offering plant-based milks. Again, we're already a lot of the way there. People know this. You're all here. All my colleagues are aware of the climate crisis and are aware and see every single day evidence of the sickness of their patients. So we're not actually fighting against a lot of argument. People are here for this. And the most important factor when deciding what to eat in hospital is healthiness. And we're not providing that. So this is what people want. This is what we could be giving them, and we're not. So that needs to change starting from today. A lot of people worry about feedback. So one of the things we also get is, well, if we change the food, people will give bad feedback about the food to the hospital. But current feedback for NHS food is not great. So I think 7% of people perceived NHS food as delicious. We have a low starting point. We can this will solve this problem too. We could do so much better. And 11% consider hospital meals to be healthy. But 94% believe it's important for hospitals to promote healthy lifestyles, and 64% believe that hospitals should prioritise offering healthy meals. And 35% of people support the switch to an entirely plant-based menu in the NHS. So that would go along the same lines as plant-based universities who are looking for entirely plant-based, all catering outlets. 35% within this survey. This is a consumer survey of 2,000 people, so this was a commissioned survey. This wasn't self-selected people that are from our organisation. This is a consumer survey. So people get it. The things that would also help people to change their choices are the things that would be very familiar to you. So if it tastes good, they'll eat a plant-based option. If it looks nicer than other options, then they'll go for it. If it's healthier, they'll go for it. And actually, familiarity is the one that people talk about a lot, but only in this survey, only 15% of people said that that was a really important factor. So people are also open to trying things they wouldn't cook themselves at home if it's tasty and looks good and is healthy. So real opportunity here for the NHS to be a real leader in helping people to make different choices. The public thinks there are many potential benefits for meat-free meals. These are kind of the top choices when they were asked what the main benefit was. So environmentally friendly, healthier, might encourage people eating more healthy outside of hospitals. We haven't talked about inclusivity. So currently, many of my patients, because I'm in London, we have a very diverse population, are lactose intolerant, and yet we serve them milk-containing and dairy-containing things all the time. And that's fine, apparently. I don't think that's fine. I don't think that aligns with any of our equality, diversity and inclusion commitments, never mind our health and climate commitments. So actually, if we're thinking about being inclusive to all cultures, we can solve that problem too. What are we proposing today with our Plant First healthcare campaign? We're proposing that we normalise plant-based meals. And what this means is, similar to the campaign that's been incredibly successful in New York, is that when a patient is offered a meal, the first option that they're offered is a plant-based chef special. Something delicious and nutritious and plant-based. If they don't want that, no problem, they're offered a second option, which is also plant-based, but perhaps is spicy or doesn't contain tomatoes or something, so there's two options that both of which would satisfy lots of people. If they don't want either of those options, no problem, we have not constrained choice, they can have the full menu, which can include meat and dairy if that's what the hospital wants to do. So it's not about restricting choice, it's about flipping the norm and completely normalising plant-based foods as being healthy, sustainable and delicious. And we think this could be incredibly powerful. This uses evidence-based approach on how people change behaviour. Because most of the choices we make every day are actually not that conscious, and we know this. It's what's convenient, it's what's there, it's what's the norm. And so, but just by making that flip, at the moment the norm is animal-based food. If we just flip that norm to be the norm is plant-based food, then that simple thing in itself could have absolutely huge implications. And because it's inclusive and because it doesn't limit choice, there's really very little to say that this would be a problem. This is implementable, this is acceptable. We really think it's a really powerful approach. And we have a plan as to how we might deliver it. So we're incredibly grateful that Greener by Default, who were behind the New York campaign and so have all of that wealth of knowledge and experience about what works and how to get everybody in the whole organisation really enthused about this approach, now have appointed a UK dietitian who's here with us today. And so the offer really is organisations just need to sign up to be interested in this approach, and then Greener by Default as an organisation is there to support them make it happen. And so what we need is really for everyone to be clamouring for this, and so that we can then start with the doing. And we've got huge support from a number of different organisations, and that includes Real Zero, who will be looking to work with procurement managers and the kind of that side of things, because much of our food is outsourced, so we need to tackle the complex food environment within the NHS, but very doable with contracts and with the right approach. Obviously, we are here as plant-based health professionals to help fill the education gap with health professionals. That's sort of our main priority. And so we have a workshop coming up very soon with the British Dietetic Association Sustainable Diets Group, really to get dietitians up to speed on the latest evidence. So we'd really welcome people to share that. And this is just a reminder that, back in the day, doctors recommended cigarettes. And we're seeing the same thing. So we talk a lot about the sort of tobacco playbook, and we're seeing this with the climate crisis. What we hear a lot is denial, diversion, and then confusion, throw in lots of worries. And what we need to do is get rid of all of that and just focus on what we need to do and what will be best for patients, which is what we did with tobacco in the end. It took a while to get there. The evidence was in place years before, and we're seeing many of the same parallels today. The evidence of what is a healthy, sustainable diet is available. We just need to act on it, and we can't let misinformation get in the way.